based on evidence that you'd seen before? Because I'm sorry, evidence from a BBC Panorama programme and a couple of articles in the BMJ is canaries potentially in a coal mine.
Our Health Secretary, Wes Streeting, was invited to a Health and Social Care Committee meeting on the 8th of April 2025, where the Chair and Lib Dem MP, Layla Moran, gave him a bit of a grilling about the time, when in an interview, Streeting decided to open his mouth and put his foot in it about mental health overdiagnosis. And there are a couple of things he did and said that really struck out for me.
Can I just ask you about a comment you made about overdiagnosis? What's the evidence for that?
Well, we've certainly seen a debate since I was asked a question on Laura Kuenssberg about this issue, and I think it is a welcome one. I think
what specifically has been diagnosed, and what evidence do you have
let's just look at some of the things that have been said and written since my comments. The total number of antidepressants prescribed in England increased by 36% between 2016 and 2023, with a concomitant 23% increase in the number of patients receiving antidepressants over that period. We've got the BBC Panorama investigation found that patients are being offered powerful drugs and told they have ADHD after unreliable online assessments. And indeed, Professor Sir Sam Everington and Professor Anise Ismail, both distinguished GPs, wrote in the BMJ recently, too many GPs are under pressure to issue fit notes rather than support and properly evaluate the request. There needs to be a cultural shift about mental health so that return to work is recognised as part of treatment, except for severe mental health problems. So I think there are a number of things that are going on simultaneously here, and I think it's so important to kind of distinguish between a whole range of factors and pressures. The first is there is anxiety within the medical profession about overdiagnosis and overpathologising of anxiety, day-to-day stresses and pressures and well-being issues, which, by the way, do require support, but where there are concerns there. At the same time, and I certainly felt this in the wake of my comments to the BBC, at the same time, there are lots of people who are saying, overdiagnosis? I can't get access to a clinician who can give me a diagnosis, let alone access treatment. Both of those things, I think, are true and are also related. And I think we've got to distinguish between people who should be on a mental health treatment pathway and those people where earlier intervention with challenges in their lives early on would stop well-being issues becoming mental illness or, worse still, mental health crisis. And I think that's what we're seeing, and that's why we want to make sure we're intervening far earlier.
I was really struck by, in your answer, you said since you were asked the question. So when you made the comment that there's overdiagnosis, had you not looked into that before? Was this not? Was
no,
this
that's
a
why.
comment
I mean, look, that's why.
Based on evidence that you'd seen before? Because I'm sorry, evidence from a BBC Panorama programme and a couple of articles in the BMJ is canaries potentially in a coal mine, but I don't understand this to be a well-evidenced.
Well, I think those numbers on prescriptions of antidepressants, I think, should be cause for concern.
That could as well be explained by the fact that there is unmet need out in the community, which we're investigating as part of our inquiry, is it not?
Yeah, well, I welcome further debate on this, but I absolutely stand by what I said on the BBC to Laura Kuenssberg, and I appreciate. Sometimes suffer with this affliction of answering direct questions honestly, and that's what I did on Laura Kuenssberg, based on the concerns that clinicians have put to me and lots of families have put to me about anxieties of over-pathologising of well-being issues, and particularly in the CAM space, young people ending up on CAM's waiting lists with well-being issues which should be dealt with far earlier and more quickly, which is why we've committed to the rollout of IAPS in every primary and secondary school in the country, so that those well-being issues that young people experience do not become mental health illness or, worse still, mental health crisis. We've got to tread carefully in this debate, because what I wouldn't want, and what I certainly think lots of people heard when they heard that interview was the sort of Secretary of State for Health and Social Care saying there's an overdiagnosis at the same time they were feeling they were unable to access a diagnosis. And I just say, I think both of those things are true simultaneously, as is often the case in terms of the pressures we're seeing in our health services at the moment. And I think we certainly do, I actually welcome the clinical debate on this, and there are lots of clinicians who are seeing this, supporting what I've said, feeling the pressure, at the same time as people who are cautioning, again, quite rightly and understandably, not to underestimate the level of mental health pressures that exist, particularly for children and young people, but more generally in our society at the moment. I think both of those things can be true.
Like I said before, there were a few things that stuck out for me. Now, I'm no body language expert, but the way he hurriedly went through his papers gave me the feeling that he wasn't too happy that this embarrassing moment was being brought up again. And he then spoke about how much of a great debate there had been since he opened his mouth and put his foot in it that time. And for me, speaks of someone who knew he had made a complete prat of himself that time and was wishing people would just shut up about it. After he had hurriedly scurried through his papers to find what he was looking for, was it a statement to apologise for that time he had, opened his mouth and put his foot in it? No, it was some panorama interview with statements from experts, which he said he had picked up since he opened his mouth and put his foot in it to double down. Thing is, Wes, if you just admit you didn't explain yourself properly that time and made a bit of a pig's ear of it, and you want to take this opportunity to explain yourself better here and now, I think people would accept it and move on. Doubling down just makes you look more arrogant to those whom you've insulted, doesn't it? Finally, the bit about where he talks about those getting upset about him giving an honest answer absolutely screams of victimhood to me. Yes, I've made light of those who are suffering terrible mental health issues with a crass statement, but hey, stop being a sensitive snowflake and suck it up, buttercup. If you can't handle my honesty, get over it. While, in the same breath, he talks about talking about this subject with an air of sensitivity and candour, so to speak. Let's be honest, you cannot have it both ways, can you? But anyway, those are my takes. I thought Layla Moran was absolutely brilliant when she picked up on his statement about the time he opened his mouth and put his foot in it. Also, the canary down the coal mine was a good line as well. She made him look incredibly uncomfortable, didn't she? Well done, Layla. But what do you guys think? Let me know down below. And if you enjoy everything House of Commons, Select Committee meetings, and anything political, please like and subscribe. And I shall bid you farewell and take care, my friends.